we're hearing some more positive news out of New Jersey, which is that a preliminary test for Ebola for a healthcare worker who had returned and arrived at Newark yesterday from the hot zone. She has preliminarily tested negative for Ebola. However, she's still at University Hospital in Newark this morning.
The New Jersey healthcare worker who's been quarantined, we know she's been tested negative. Preliminary tests. Are we expecting other tests? And after this negative testing, should we expect to see her removed from isolation or quarantine, rather?
Well, at this point, sure. At this point, what the State Department of Health in New Jersey is saying is that she is still in isolation. She's still in quarantine. She's at the hospital, and she's being observed by healthcare officials. While they did say that this was a preliminary test, they said that at this point they would be consulting with the CDC and the Department of Health to determine if or whether further testing would be needed. But this all comes on the heels of New York and New Jersey deciding to ramp up their efforts to regulate and restrict people who are coming back from the hot zone. It was just yesterday that Governor Cuomo and Governor Christie announced a mandatory quarantine for anyone returning from the hot zone who had been in direct contact with someone with the virus. This healthcare worker arrived at Newark. She was taken to the area to be examined, and what we understand from the State Department of Health is that she did not show any symptoms when she first arrived. They say, however, that she developed a fever at the time that they were checking her out. That's when the decision was made to bring her to University Hospital in Newark. That's one of the hospitals that's prepared to deal with these cases. From there, they did the testing, and at this point, again, the headline this morning being that that preliminary test has turned out to be negative.